The need to socially isolate and distance ourselves can be certainly tough on our emotional well-being, and that's especially true for more vulnerable populations, including senior citizens, many of whom are home alone. Joining me now is Nora Duncan. She's the state director of the AARP here in Connecticut. And Nora, thanks for being with us here tonight.
Thanks for having me, Dennis. I appreciate the opportunity.
I know in our household, we're constantly calling the grandparents. I'm telling the kids to keep in touch with them, FaceTime and so forth, because it's very important because they are by themselves. But let's begin with your advice for folks on how to deal with loneliness.
Well, loneliness and social isolation was a concern before the coronavirus, so it's certainly a concern now. 43% of people age 60 and up reported loneliness before this happened. When you were maybe going to the senior center, or you were seeing the grandkids, or maybe you saw a church service every Sunday and your friends there, now you're not seeing that. So, we need to sort of gather together as a community and really think about how we can help people who are experiencing this coronavirus in a very different way than I might be, and help them avoid the social isolation and the loneliness.
So how can we help them? Specifically from a distance, how do we help an older relative or a neighbor?
When we have a blizzard come, we say, check on your elderly neighbors and see if if they need their walk shoveled or something. I mean, we're kind of in this think of it as a really long blizzard. So the phone is obviously a way to communicate.
Sure.
We've got the Skype and everything else, but some people aren't connected virtually like you and I are right now. So I love the example of the kids in Berlin who did the chalk on the sidewalk. We can do that in our own neighborhoods. You can be a friendly face at the window, and you can ask if somebody needs a little help with errands, maybe. I mean, I might only be able to go to the grocery store, in a really different way than I could before, but I can help that neighbor and check in on them and make sure they know that someone cares and is worrying about them and going to help out.
Good advice. Hey, how can loneliness impact overall health?
Well, there are studies out there that say it's the equivalent of smoking 15 cigarettes a day.
Wow.
So that probably sums it up for us. And with this many people lonely before, this is a problem that was a public health crisis in and of itself, and it's just going to get worse unless we, come together and try to do the best we can in these difficult circumstances.
Nora Duncan, we thank you for all this advice and insight tonight, and always great to see you.
Thank you.